Thank you. Is that on? Yeah. Okay. The touchstone for my remarks is, not surprisingly, the already much alluded to landmark report of the Global Commission on HIV and the Law, which builds on the body of social, scientific, legal and critical theoretical studies that has developed to address the social, legal and political drivers that are so central to the advance of the epidemic. As we know, HIV is very much an exploiter of social fault lines and is, in the final analysis, in the words of Paul Farmer, the great HIV doctor and human rights advocate, an epidemic of poverty and an epidemic of structural violence. Moreover, it is one that is driven by the application of criminal law to behaviours and communities that have been scapegoated by normative society. It is then no surprise that 2 decades before the outbreak of the HIV epidemic, that Irving Goffman, in his landmark study Stigma, a study of social spoiling, grouped together 3 of the communities now known to bear a massively disproportionate burden of the disease, namely sex workers, men who have sex with men, and people who inject drugs. The Commission concluded that the legal environment, laws, enforcement and justice systems has immense potential to better the lives of HIV-positive people and to help turn the crisis around. But nations have squandered the potential of the legal system. Worse, and this is the section I want to emphasise, punitive laws, discriminatory and brutal policing, and denial of access to justice for people with and at risk of acquiring HIV are fueling the epidemic. These legal practices create and punish vulnerability. They promote risky behaviour, hinder people from accessing prevention tools and treatment, and exacerbate the stigma and social inequalities that make people more vulnerable to HIV infection and illness. And herein lies the crux of what I would really like to say in these few minutes. The reality for key affected populations, all of whom have in common the fact that they are subject to the imposition of either blanket criminalisation of their behaviour or status, which in and of itself drives and often justifies rampant social stigma and discrimination, which in turn drives us away from what services do exist, or makes those programmes, such as needle and syringe exchange, in and of themselves illegal. Or it leads police officers to use the fact that we possess prevention commodities, needles and syringes in the case of people who use drugs, or condoms in the cases of sex workers, as an excuse for arresting and harassing us. Such repressive legal environments play a determining role in and are the major factors driving the widespread violations of the human rights of members of key affected populations, of criminalised communities, and positively drive transmission of HIV amongst us. The creation of an enabling legal environment is critical to the success of community-based prevention programmes, and indeed without which they cannot hope to function effectively. No properly public health-oriented or meaningfully human rights compliant response to the epidemic can be effectively mounted under conditions of the war on drugs, properly called the war on people who use certain drugs, without thorough reform of the global legal architecture which drives and justifies that war. This is in spite of recent claims from numerous quarters and some agencies to the contrary. That, at a minimum, the decriminalisation of drug use and possession is a sine qua non of effectively preventing HIV and HCV transmission in the injecting community is also underlined by the very welcome recommendations of the recently published consolidated guidelines on HIV prevention, treatment and care for key affected populations. The criminalisation of same-sex relationships, of sex work, of drug use, and for people who use drugs, of the very harm reduction programs that we rely upon to more safely use our drugs of choice, creates a climate in which civilian and police violence is rife, and legal redress for victims impossible. Fear of arrest drives members of our communities away from these services. It keeps us underground and away from HIV and harm reduction programs. Incarceration and compulsory detention centres exposes detainees to sexual assault and unsafe injection practices, while condoms are contraband and harm reduction measures, including the provision of ART, are denied. Whilst we are seeing an increasingly triumphalist biomedical rhetoric that the end of AIDS is within reach, a rhetoric driven in particular by the promotion of treatment as prevention and pre-exposure prophylaxis, or PrEP, such language seems particularly untenable and unrealistic when viewed from the perspective of the drug-using community. Within the injecting community, we currently have a treatment gap of 96%, combined with a massive funding crisis for harm reduction. In such an environment, talk of ending HIV seems particularly empty, and in the case of PrEP, quite profoundly unethical, when only 4% of positive injecting drug users who need ART to protect their own health and well-being are denied it. Talk of providing PrEP seems singularly unrealistic. Over the last few years, it has been increasingly widely recognised that two bodies of international law, namely human rights law on the one hand and drug control law on the other, exist in parallel universes. Professor Paul Hunt, former UN Special Rapporteur on the right to the highest attainable standard of health, made the latter remark in a report in which he also noted that this widespread systemic abuse of human rights is especially shocking because drug users include people who are the most vulnerable and most marginal in society. Despite the scale of the abuse, despite the vulnerability, there is no public outrage, no public outcry, no public inquiries. On the contrary, the long litany of abuse scarcely attracts disapproval. Sometimes it even receives some public support, and that has been confirmed by community-based research in Australia. To be explicit, the pursuit of repressive drug control in the name of the war on drugs has inexorably driven rampant human rights abuses against people who use drugs in their communities. That one set of international laws is systemically driving breaches of another, is an increasingly untenable and unjustifiable situation. Whilst there may be no hierarchy of legal systems, it is arguable that human rights law and the principles upon which it is based, principles that are defined as indivisible, inalienable, and universal, should unequivocally trump the pursuit of another set of laws that are producing such gross rights violations. When the pursuit of drug control law becomes the driver of widespread human rights abuses, as it undoubtedly is, and on a massive scale, it is without doubt time to call for a thorough review of those laws. As the Global Commission on Drug Policy put it in their report, The Negative Impact of the War on Drugs on Public Health, the Hidden Hepatitis C Epidemic, instead of investing in effective prevention and treatment programs to achieve the required coverage, governments continue to waste billions of dollars each year on arresting and punishing drug users. A gross misallocation of limited resources that can be more efficiently used for public health and prevention approaches. So this passage makes very clear the mechanism by which repressive drug policies drive and produce violations of the human rights of people who use drugs. That the pursuit of drug control, the maintenance of punitive prohibition, and the war on people who use drugs is indeed driving such breaches is now quite beyond question. When you define the pursuit of public policy, defined by both national and international law, as a war, you are going to produce war casualties, and arguably unintended, and in this case decidedly negative consequences. In response to this war, we have long called for a peace, for an amnesty for drug war prisoners, for an end to the violence and rights violations that have been heaped upon our community, and have called for an open and intelligent debate on alternatives. So this war against the supposed threat to society that the evils of drugs pose has in reality made communities of people who use drugs the real targets, has made us into casualties of war. It has stigmatized us, discriminated against us, pathologized us, and made us scapegoats for much of society's ills. There is then a direct correlation between the rigorous application of repressive measures against people who use drugs, including the criminalisation of harm reduction programmes, and a more enabling legal environment. The UK, for example, the country from which I come, like Australia, were amongst the first countries to roll out quite comprehensive access to needle and syringe programmes, and have managed to drive down HIV rates amongst the injecting community to negligible levels. But on the contrary, Russia, which has maintained the criminalisation of all harm reduction programming and has executed a particularly vicious war on the injecting community, has prevalence rates of up to 75% or more in some regions amongst the injecting community. In several Southeast Asian countries, which maintain compulsory drug detention centres, hundreds of thousands of people who use or are even suspected to use illegal drugs languish with no access to harm reduction programmes, limited access to ART, and under a regime that amounts to cruel, inhuman or degrading treatment, and often reaches a level of torture, HIV and hepatitis C rates are not surprisingly particularly high. So almost everywhere, drug policy falls under the aegis of law enforcement. It is certainly not in line with human rights norms, and as indicated above, seems to operate in a parallel universe from human rights law. Without thorough implementation of the recommendations of the Global Commission that impact upon people who use drugs, we will not, and I say this quite bluntly, see any end to the epidemic amongst the injecting community. And those recommendations, let me remind you, include the closure of all compulsory drug detention centres immediately, the abolition of national registries of people who use drugs, and the end to mandatory and compulsory HIV testing and forced treatment for people who use drugs. The repeal of punitive conditions upon funding, such as the US federal ban on needle and syringe programs. The decriminalisation of the possession of drugs for personal use. And most significantly, for me at least, decisive action to review and reform the relevant international laws and bodies, including the 3 Global Drug Control Conventions and the International Narcotics Control Board. These decisive steps are the minimum that is needed to ensure that the health and human rights of people who use, and in particular people who inject illegal drugs, are protected and realised, and is the only foundation upon which any effective and meaningful attempt to seriously address and reverse the interlocked epidemics of incarceration, HIV and hepatitis C that are ravaging the drug-using community can be built. And it is this message that I would urge member states and UN agencies to take into the UNGAS special session on drugs in 2016. Thank you.